Good morning, everyone. Thank you for joining us today. We are excited to have you with us for our webinar with Laura Valancourt on mental health and aging, talking through the stigma. My name is Angie France. I am the product manager for Prestige Senior Living. Prestige represents 42 assisted living and memory care communities on the West Coast. We hope that you maybe visited some of our communities throughout your time looking for maybe assisted living or independent living or even memory care. We really seek to serve residents for all their basic needs and really try to find ways that we can also be a resource for you through these webinars that we present, usually bi-monthly. We're grateful to have you with us today. We have a wonderful advantage of being able to Zoom, something we learned through the pandemic, and we continue to utilize Zoom webinars for these wonderful informational sessions. Today, we are so grateful to be with us, to have Laura Valancourt with us. Laura has been a friend to Prestige for many years and a friend of mine, and she has certainly been an encourager to all of our communities through these webinars, as well as those who are tuning in from all around the country, actually, to be able to find resources on mental health and aging. She is a licensed mental health counselor. She's a geriatric mental health specialist and an elder care coach. She works with Elder Care Services out of Olympic, Washington. She owns a group practice that really specializes in serving the aging population, and she has such extensive experience as a consultant providing counseling, coaching, and care management to families in the midst of making difficult decisions related to their loved ones' care or their health transitions in life. She is a passionate speaker and an educator on topics related to dementia and caregiving. And she is also the host of her own podcast called Life on Repeat, a dementia caregiver podcast. We hope that you would find that interesting and tune into her Life on Repeat podcast. She's had so much experience talking with families, comforting families. Many of us, we see how dementia and mental health needs affect our loved ones, and it can be a really difficult time in life. And we are so grateful, Laura, to have you with us today to share some of your expertise on what affects mental health in our aging population. But I know from our last webinar, the information you speak is really vital to any of us who are tuning in, no matter our age. We have a mental health crisis in our country, and we are seeing more and more help available, and you are one of those resources. So for anyone who's tuning in today, I know that you will find it so beneficial and so helpful to encourage you in your own life, as well as the loved ones that you're looking or taking care of as a caregiver in your own home. So thank you so much, Laura, and I'll let you take it over and get started.
Oh, wow, Angie, thank you so much. I am always so happy to come and talk to folks, and really, especially, I love Prestige and have many years of the opportunity of getting to work with your company. And anyway, just very grateful to have the opportunity to share with folks. So I will start this slideshow. And
Laura, I might mention too, to those that are tuning in today, that we do have the chat or the Q&A available, and we will be answering questions at the end of the presentation.
Absolutely. Yep. Put your questions in. I'll hang out afterwards for that. I'm happy to do that. All right. Well, I hope everyone is having a good start to your Friday, no matter where you are in the country. I'm going to just orient myself here a little bit. One of the things that Angie kind of alluded to is that, really this perspective that we really are all aging. From the moment we're born, we're aging. And with aging comes change, and with change comes loss. And we learn, sometimes that loss can actually be framed as positive, and sometimes it's framed as negative. Sometimes we have control over the loss, and sometimes we don't. Again, sometimes it's welcome and sometimes it's not. But I always like to start out with that perspective of we are all aging. Every day we're growing, we're changing, we're experiencing all kinds of things in life. So, all right, let's get, there we go. All right, so we'll just hop right in, and I want to just kind of briefly touch over the things that we're going to talk about today. Hopefully I make it interesting to you. I know sometimes these topics can be dry or even depressing. So my goal is to make it interesting and like Angie said, applicable to you no matter where you are in life. So we're going to cover today why it's important to understand depression, and specifically with the aging population. We'll talk about what depression is. We're going to also talk about how to recognize if you or your loved ones are not doing well regarding your mood or your well-being. We're going to explore who's most at risk, how to minimize the risk, and then what to do if you feel that somebody needs some extra support. And then the second half of the presentation, we're going to talk more about how to minimize the risks of depression and mood disorders, and how to, even prevent it. And that, hopefully that will be a fun second half of our time together as well. So let's just start out by talking about why is this topic even important? Why would anybody benefit from knowing about aging and mental health? Well, here I just made a nice little list of some reasons why. So I'm just going to touch on each one to get us going. This piece of promoting holistic well-being, what I really mean when I say that is that when we recognize and address mental health concerns in older adults, it really just allows us to have a more comprehensive approach to their overall health and well-being. Just, overall, that's what everybody wants, right? Is to just live their best life. And so that's the goal of promoting this holistic well-being. Enhancing communication and support enables family members to have more meaningful conversations and to provide appropriate support during those challenging times. Again, we're going to talk a lot about how, it's normal to have feelings. We're human beings, we're experiencing life. And we would be worried if a person wasn't having appropriate reactions to their environment or their situation. And so, again, what we'll talk about a lot is how do we recognize when it becomes a problem, and how do we support people in, because sometimes it can become a problem when we're not expressing it, or we're holding it in. That's often when depression rears its head, when we're not grieving or processing in a healthy way. So back to my points here. The communication and support is really important. So we want to support these meaningful conversations during challenging times. And the way to do that is to start having these conversations when it's not challenging. So then it becomes more easy and more fluid and more normal to talk about how things are going with each other. Identifying red flags early. Again, it's just helpful to recognize these warning signs in a timely way so that we can prevent further deterioration. Catching it early is always, with any health condition, is always the best way to get on top of things. Breaking down the stigma. As you can imagine, mental health in the world has, many years of stigma attached to it. So people, especially our older generations, have really learned that by acknowledging their depression or struggles, that it was often seen as a sign of weakness, and people were encouraged. I'm sure you've all heard that, you don't air your dirty laundry with anyone else. And so there's a big cultural and generational piece attached to not sharing your innermost experiences or feelings with other people. And so it's important to break that stigma down, of course. I put improving family dynamics because, it's an opportunity when we can really support our older adults who are struggling. It's an opportunity to promote empathy, and really that's good for everyone. And when we talk about the family dynamics that are old and long lasting, I guess I always like to just reframe crisis or chaos or challenges or struggle in the perspective of where's the opportunity in this? How can this be an opportunity for growth? And it's amazing to me how difficult it can be to go to those places and have these conversations. But when we do it, we always come out better for it. We always learn from it. We always grow from it. We always get closer. And I know that's a big statement to make. And I know that sometimes people have attempted to have conversations and it's not always welcomed. And we'll touch on that a little bit today too. But I think overall the intention and the opportunity for improving those family dynamics is really, really there. So optimizing caregiving. So there's a couple, I put caregiver in here twice. So optimizing caregiving, basically what I mean by that is when we are able to recognize and support folks who are struggling with their mood as caregivers, it's going to help tailor our approach as family members in how we are providing compassionate care. And then preventing social isolation. This is just a common, we'll talk more about this too. There's some amazing studies out there that talk a lot about happiness and aging and mood and aging, and preventing isolation is really paramount. Now that can mean different things to different people. Some people feel isolated when they're surrounded by others. I talk about when I worked in hospital settings or in skilled nursing settings, and how, you have shared rooms, you have housekeeping coming in, you have nurses coming in, you have visitors coming, you can be surrounded by people. I can't tell you how many of my clients reported how isolated and lonely they felt in those settings. So it's not necessarily about how many people you're surrounded with or how many activities you're doing. It's tapping into that sense of connection that is so important. Empowering informed decision-making. And really this comes back to also, to both the person experiencing mood concerns, but also the family. When we understand what's going on, when we understand the mental health condition, then family members are going to be able to make well-informed decisions about treatment options or therapy or long-term care, whatever that looks like. Let's see. Where am I at here? Sorry. Maintaining dignity and independence. Promoting autonomy. This is a huge piece, and I hear this from so many family members, is there can be such a shift. We talked about the family dynamics piece, and I meet with so many family members that are struggling with how do I honor my parents or my spouse's autonomy and decision making, and also support them by moving them along to get the care that they need. And this is just a huge piece. And I just want to acknowledge that when we are addressing these mental health concerns, it's a way of supporting the older adult in having a better quality of life and having more, like I said, autonomy and dignity with that. So reducing caregiver stress. Supporting caregivers is near and dear to my heart. And basically, we can help family caregivers cope better with their roles and reduce their stress. And, this piece that can come along with burnout or guilt, or, I often, I could say 99% of the family caregivers that I meet with are also grieving while they're caring. And so I think that this is a huge piece, that we can't, so often the focus is on the person that needs to receive the care. And we all need to remember that the people that are providing the care, the family members, are being directly impacted as well. So we're going to talk a little bit about that as well. And mental health impacts on physical health outcomes and longevity. I love this kind of stuff. I do have a slide in here. We'll talk a little bit about, there's been a lot of studies, as you can imagine, a lot of research on how our mood impacts our physiology and our biology and our longevity, essentially. So let's just talk a little bit about depression. And I kind of want to preface this this whole presentation. It was not my intention today to go through the DSM criteria and talk about medications and traditional kinds of support. We could always do a talk like that. But what I really wanted to do today is really speak to your experience as an aging individual, your experience as a caregiver, and really look at some things that hopefully you might find more practical, some things to know about and things you can do. I always encourage you, just from the get-go, to reach out to your medical professionals, whether that's your primary care doctor, or if you have access or seeing a licensed mental health counselor. It can be that's always the gold standard, is to go there. And again, I'll talk about the reasons why as we get going here. But when I put this slide up, let's talk about depression. What I really wanted to do is just highlight some of these key points, because I think there's a lot of misconceptions too around mood disorders and depression and what it really is. But what I will say to start is depression is not a normal part of aging. This is, I feel, like I have to say this, because it's not so much that families come to me and they just think, oh, well, I'm just getting older. This is part of getting older. Some people do that, but I also hear doctors say that. And I'm always just shocked that a doctor might give that message to an individual or their family. So please take this away with you today, that depression is not a normal part of aging. In fact, and I wish I had the numbers and I don't, so I apologize, but when we look at, there was some research done that showed, I wish I had the statistics, that there is research that shows that there are more people aging well than are not. And that is huge. And it was by big numbers. And I think when we are put in a position, again, of being a care provider, or even working in the medical profession, or working in the world of aging, we often see people that are not aging well, and we think that that's what aging looks like. But we don't often see the people that are aging well. And so I just want to throw that out there, that more people, and I'm sorry I don't have the numbers, more people are aging well than not. So the most prevalent mental health condition in older adults is depression. So that's kind of what we're going to mostly talk about today, is depression. There are, as I'm sure you know, numerous mental health conditions. Another prominent one that we often see is anxiety. So we'll touch on that a little bit. But I guess I want to really talk about like what's normal and what isn't too. It's important to differentiate when somebody is having a normal response. Kind of like what I said in the beginning, is that it's very normal to have an emotional reaction or response to life. And we have learned over the years how to cope with things and how to move through life in certain ways. And some of those coping strategies are really helpful and some are not. But the difference is that when your mood experience or symptoms are getting in the way of your daily life, or it's keeping you from enjoyment, or it's limiting your daily activities, or it's going on for a certain period of time, that's when it's a problem. And there is a criteria that we as therapists and other medical professionals follow to actually have a quote diagnosis of depression. But depression and feeling depressed are very different things. And I will, in our next slide, I'll touch on some of those pieces so that you walk away with a little more clarity. I promise you, I want to make sure that you feel by the end of this talk today that you're aware of when to be concerned and certain things that you can do. And when, you know, someone is having a normal or quote, normal reaction or response to an event. I talk about here depression and dementia. You know, as Angie said, dementia is near and dear to my heart, serving families and folks who have memory impairment. And we always want to rule out depression when there's memory concerns and vice versa. We always want to be looking at, are there some memory concerns that are happening when someone is presenting with depression? It goes both ways. Caregivers, I can't tell you how many caregivers or family caregivers are caring for somebody who has memory impairment, and they come to me in fear saying, I think I have dementia. You know, I am not remembering things. I can't keep anything straight. I'm losing it. And then we talk about it, and you know, people begin to understand the impacts of stress and the impacts of not getting good sleep or good hydration or nutrition, and how that will impact your memory. It doesn't mean you have dementia. It just means that that your memory is going to be impacted by your mood. Same goes for people who are not caregivers, people who at any age are experiencing depression. It's definitely going to impact your memory and cognition, but it doesn't mean you have dementia. This comorbidities piece, I think it's important to understand that we often see with people who have heart disease or diabetes or pain or dementia, like I mentioned, they often also will have some depression. So again, the importance of screening that for those individuals is pretty high. And then this piece that I alluded to before, feeling depressed versus having depression. So again, feeling that way can be a normal reaction to change or loss. And that's very different from a diagnosis. So the DSM is basically the standard that we use to diagnose folks. They have to meet a certain criteria. And the criteria for depression, and there are also different types of depression. There's persistent depression, there's major depressive disorder, there's seasonal affective disorder, bipolar types 1 and 2 are associated with depression. But what we look for is that there's 2 weeks or more of 5 or more symptoms, and we'll go over these symptoms here in the next slide. This slide, I wanted to throw this slide in here because I think it's important for people to recognize, right, that older adults, while we're aging, you know, always, and older adults don't necessarily experience depression differently than anyone at any other age, although there is a couple things that I will mention. These are some unique experiences that many older adults have that most people that are younger may not have. And so I just threw a brainstorm list. I'm sure you could add to this list. But think about this for a moment, the variety of loss that individuals experience. And when I say loss, you know, I'm talking about deeply personal experiences. So it may be the loss of the ability to be independent in decision making, or I'm talking about the loss that people experience with their physical bodies, just the loss of not being able to hear clearly, or, which impacts your ability to understand, your abilities to see or walk. But then also, again, not bigger, but the other side of loss is losing your support systems. Many older adults have experienced a lot of loss over their lives just because of the nature of how long they've lived. And so recognizing that. Now, this can also, believe it or not, be a gift too, a strength, if you will. Many older adults have learned amazing coping skills and amazing sense of resiliency by experiencing loss throughout their life. And so when we work with people who have depression or mental health concerns, we're often looking at their history of loss as well, because we can both begin to understand why someone might be experiencing their pain in a certain way, if it's tied or attached to a previous experience. But we can also do the same thing and tap into the strengths that individual may have gained from those life experiences. Pain is another thing that can often contribute to someone's mental health. I can't tell you how many people that I have seen with depression, and then when we get their pain under control, things level out. Our physical bodies and our mental and emotional states are totally connected. And so we have to look at the body as a whole system, as a whole being. Sleep is huge, as you can imagine. When our sleep is impacted or we're not getting good sleep, that's definitely going to impact our mood. The thing to know about sleep too is that often people are not very good historians of their own sleep. So when someone asks you, do you sleep well? Or how did you sleep last night? Some people will say not very well, and some people will say I slept great. But then we later realize, and they don't even know, that they were snoring all night, or they didn't dip into enough REM sleep, or they didn't even remember that they got up more than once to go to the bathroom, or, the quality of sleep is very big. And there's a lot of tools out there now that will measure your sleep and track your sleep. And so it's been really helpful for those of us that are concerned about people's sleep when it comes to their well-being. So I've got I don't know if you can see it. I've got a little ring here. It's called an Oura ring. And it tracks my sleep at night. I have a little app that I can follow. But the watches, there's all different tools out there now that can help people with that. Medical complications. So as you can imagine, older adults often experience medical complications that many others wouldn't otherwise have. And it's just adding more layers, to challenges in life and outlook in life. So we always want to be looking at that when we're working with older adults and we're concerned about their mood. Memory loss and impairment, I kind of addressed that before. There is a comorbidity there. So we want to pay attention when someone is diagnosed with a dementia, a type of dementia, that we're also keeping a close eye on their mood. And the change in family roles, we kind of touched on that a little bit already too. Many older adults are experiencing a change in family roles. Maybe someone was the matriarch of the family and the one who hosted things and the one that made sure that everybody was connected. And then suddenly they're not able to have that role. And how does the family adjust to that? That's huge. Caregiver relationships, again, how it impacts the caregiver and how it impacts the person receiving the care if they had a different relationship in the past. Older adults are also, it's a natural part of the aging process to look at your life in reflection and do this kind of life review. Sometimes people are very conscious about it and sometimes they're not. But that can, again, that's one of those things that can be a positive. It can really reinforce the strengths of an individual and also present opportunity for like unfinished business or clearing up or reframing the way things, the way that they understand how things happen in their lives. And sometimes, again, it can bring up some negative things. So that's sometimes a little bit unique to working with older adults. Facing mortality, of course. Increased suicide risk. I put that down because men over the age of 60 that are widowed are the highest suicide risk rate of any population. And a lot of people aren't aware of that. If I ask the question, what age range do you think has the highest rate of suicide? Many people think of teenagers. And the answer is really older men who have lost a spouse. And so we want to keep that in mind as well. And then the social isolation piece, of course. And that's predominantly because some older adults are not able to drive and access the world that they may have used to be used to being a part of. We also think about the variety of losses that those individuals have experienced socially as well, the fewer opportunities that are out there. So this is the slide when I talk about that DSM diagnostic kind of tool of how do we diagnose somebody with depression, 2 weeks or more of, the 5 or more symptoms. These are some of those symptoms. But this is helpful for everybody to know, right? If you're seeing these signs with an individual, then we definitely want to address that. So persistent sadness, that could look like different things. Everybody processes emotions or has symptoms that can look the same or they can look different. That's why there's so many points here as well. But persistent sadness can look like crying or tearfulness. It can look like making negative statements, this feelings of worthlessness. If you were to ask somebody if they feel helpless or hopeless or worthless, you might spark up a conversation, or you may not. And it's just the other thing I guess I don't have on here that's important to say is it's really important to understand someone's baseline. So maybe an individual has always just kind of been at a certain level. Maybe they use words more than others. I've met with a woman. I was called into a facility because they said that she was making negative statements about harming herself. And so I go in and I assess. And when I met with her, and they're doing their job, they have to follow this criteria to make sure that people are safe. And we take that very seriously, obviously. In this situation, though, she kind of laughed about it and shared, she's always made these statements. She's always said, I just want to shoot myself. And, it's more of her baseline or her personality to make those statements. So you can see the importance of knowing someone's history, understanding their baseline, really where are they at? When is it really time to be concerned? This piece of moving so slowly that others notice, what we find, and also the opposite can be true. People can become more agitated and distracted, and but we often see that they slow down. So they may be laying around more. They may be just slowly moving through life. This excessive worrying piece, again, can come in the form of finances or health, They're worried about their own health. They're worried about other people. They're worried about this or that situation. And it's sort of a external expression of what they're experiencing internally. Weight changes, that could be weight loss or weight gain. Psychomotor symptoms. And what I mean by that is when people are pacing or they're fidgeting, or the opposite, they're, again, too little movement, like we mentioned before. Sleep changes, again, too much or too little. So it's being out of balance in these areas that we're really looking for. Difficulty concentrating. When we're doing these assessments, I mean, again, like I said earlier, people that are depressed often have difficulty concentrating, and that impacts their memory because the information isn't even going in to begin with. And so that can be a little bit harder to assess for people who have memory impairment or a dementia. Physical symptoms. Okay, this is an interesting point that I learned a few years ago. There was a study done, and what they had found is that older adults with depression many people tend to not present with some of these typical ways that you might see somebody being depressed. But what they found is that people will report increased levels of pain. So this is a physical manifestation of depression. So older adults tend to exhibit depressive signs and symptoms in the body. This is something that, I talk to a lot of doctors about, and to pay attention to is when you see an increased report. Of course, you want to address the pain, you want to find the root cause, but a lot of studies have shown that when people are depressed, they're reporting more pain. Withdrawal from normal activities. And so just paying attention to someone, again, their baseline, what they're used to doing. Now, let's move on from there. So who is most at risk of having depression? Well, those that are isolated or live alone. And just like the example I shared with you when I worked at the hospital and in skilled nursing, you will see people that are surrounded by others, but they still report that they feel disconnected or isolated. And then I have met individuals who live by themselves in a house, remote, and they rarely get out, but they feel connected. And so connection is key. Absolutely. Connection is key. And that can look different for everyone. Again, it doesn't mean you have to be surrounded by people. We're going to talk a little bit later about this study that was done, this happiness study. But in that study, one of the key indicators of happiness in aging was connection, not someone's physical condition. It was connection that really determined a person's happiness, which then increased their longevity. So this is key. I know we've been hearing a lot about, especially after the pandemic, and all the isolation that occurred during that time. We can talk a lot about the impact, and I'm sure all of you listening, you lived right through that. And so you saw firsthand the impact of what social isolation did to so many people, including ourselves. So the history of depression or anxiety, what I mean by that is if somebody has a longstanding history of depression or anxiety, either their risks are just going to be higher, that, the more challenges that they may come across with, aging or changes in their life or loss in their life is going to raise the risk of having depression or anxiety. People that are recently grieving or have recently experienced a loss. And again, I don't just mean that they've lost a loved one. I'm talking about the loss of a pet, the loss of their independence, like driving or decision-making, the loss of their bodily changes, the ability to walk, things like that are huge. There are also different types of grief that people experience too. And so there's like, for instance, anticipatory grief. We see that a lot with caregivers, where people are grieving, but it isn't over. It isn't end. It's prolonged. There's delayed grief, which happened a lot during the pandemic, where somebody had a loss, but they weren't able to attend a funeral or have a funeral, or it was delayed. The cultural norms, were delayed. Just to know there's different types of grieving that are out there as well, that people, and we all grieve in different ways. There's no right or wrong way. There's no, even in the mental health field, they try to set a criteria. If you're grieving this long, then there's a problem, that's when we can diagnose. And the reality is that we're all unique individuals, and we all grieve in different ways. Somebody that has a new diagnosis or has medical complications is definitely going to be more at risk. And we kind of talked about those comorbidity piece of, I can't tell you, and Angie, I have to say, the example that I always think of was a resident in one of your buildings who had, I was seeing for depression, and he had a heart condition. And it was like night and day. When he had heart surgery, he had some stents put in, and I saw him following that surgery. It was like he turned into a new person. He was suddenly hopeful. He was suddenly bright-eyed. His mood improved. It was just such the clearest example to me of that comorbidity piece of depression and a physical ailment. Those individuals that have had recent transitions, whether that's, especially when it's unwelcome, so somebody has to move to a facility, or they're no longer able to care for themselves, those transitions can be really difficult. Chronic pain, we talked about that already. Widowed men over the age of 65, we talked about that. That's the highest suicide risk. My note here says those individuals at 6 times the suicide rate of the rest of the population. So it's something that we definitely want to take seriously. People that have memory loss or impairment have a higher risk of developing depression. And then again, we talked about the rest of these things: change in family roles, sleep disturbance, facing mortality, a history of PTSD or post-traumatic stress disorder, a high ACEs score. I don't know if you've heard of ACEs, but that stands for Adverse Childhood Experiences. And so they have done a lot of research showing that people that have been impacted negatively in their younger years, and there's a quiz you can take and figure out your ACEs score, but have a higher risk of developing depression later in life as well. All right, I'm moving along. I'm going to talk a little quicker because I want to make sure we get to a lot of the good stuff before we run out of time. This slide I thought was really interesting. I just wanted to throw this in there because people often ask, what causes depression? And I know today I'm talking a lot about life, external kind of epigenetic type of influences, environmental influences. But these are things that are actually happening within our biology. So neurotransmitters, brain waves, nutrients, hormones, immune system, and gut health all have an impact on our biology. Now, what's really cool is they're doing a lot of cutting edge research now showing that how we think about ourselves and our lives actually will impact all of these things. So what is the cause? Is the cause the biology, or is the cause how we're thinking about our lives, which then impacts our biology? So there's stay tuned. There's so much fascinating research right now on how when we change the way we think, it actually changes our gut health. It actually changes the microbiome of our body. by how we're thinking. So again, which comes first, the chicken or the egg? But this is a lot of fun stuff I could talk a long time about, but we'll move on. I just wanted to throw this in here for fun. I also wanted to put this quick slide in too about caregivers, because family caregivers are at very high risk of developing depression, as you can imagine. Many of caregivers that I meet with express that they feel hopeless or helpless. And so it's very important and imperative to support family caregivers. I talk about the many hats that caregivers wear every day. And the reality is that it often comes to one person that is providing that care. And it's almost like this delicate house of cards. If that family caregiver fails, I don't want to say fails, but if they crash and burn, the whole house of cards comes tumbling down. And the statistics show that it's often the caregiver that ends up in the hospital before the person that is being cared for, or it's often the caregiver that dies before the person that they're caring for dies. And this all comes back to stress-related disorders. And so when I meet with families about planning for their loved one's care, I am always spending a ton of time talking to the family members themselves about how are you taking care of yourself and what can we do? Let's create a care plan for you. What does that look like? How do you know when you're reaching your limit? Most family caregivers numb out and they don't even realize, kind of like that frog in a pot of water, they're fine at first. And before you know it, that temperature has been turned up and they're in a pot of boiling water and they don't even realize it. So, please, as family caregivers, pay attention and put yourself first. Dementia and depression. So, yes, I'm going to kind of skip over this slide a little bit quickly because I want to make sure that we get through the rest of the slides. But I wanted to put a slide in here because it is such a unique set of assessments and challenges when it comes to assessing for depression with somebody who has a type of dementia. And these are kind of the challenges that we see: the inability to express, quality of life, obviously decreases. Cognitive function can be exacerbated by depression. Life expectancy is huge. Life expectancy drops when people are depressed. Not normal. What I mean is it's not normal for people with dementia to have depression. Again, I want to break those stigmas that, oh, it's just because they have dementia, it comes with it. Well, they often go together. That's true, but it doesn't mean it's normal, and it is treatable. And then, medical conditions can be made worse. It increases hospitalization stays. Cooperation with care becomes more difficult, all of those reasons. So when should we be concerned? This is a nice list of when to be concerned about your loved one. When we see a change in condition or a change in someone's baseline, that is something to pay attention to. And I know some of these things we've touched on already, but I just want to overemphasize and have them all in one place for you to be thinking about. When someone has an increase in pain or they're not able to get on top of their pain, we definitely want to be watching their mood, because it just happens so often that people with pain that is not taken care of will get depressed. Sleep, we talked about the importance of sleep. Medications. So medication side effects can cause some symptoms sometimes that look like depression. So pay attention to that as well. Has there been any recent changes that might be contributing to someone's mood? People with infection can absolutely exhibit some signs of depression as well. appetite changes. We want to watch that, those co-occurring disorders that we talked about. The 3Ds, I have a slide, I think it's the next slide, on depression and delirium and dementia, and how the symptoms all mirror each other. And so it can be really difficult, especially for ER doctors, especially medical professionals that aren't familiar with your loved one. You bring them to the emergency room and you're telling them something's not right. And they're looking at the person and they think they have dementia, but you're saying, no, their memory is actually, or they do have dementia, but something is different now. And so as family members, we talk a lot about how to advocate for your loved one in that case. If someone is obviously stating that they're having negative thoughts or statements of self-harm or just negative thoughts in general, we're paying attention to that. The self-isolation, of course, physical complaints that we addressed earlier that increase with age. And it's always important to seek professional support when you have these concerns. It's okay to reach out to your doctor, reach out to, if someone has a mental health professional. I think that's really obviously beneficial. You can also reach out to mental health professionals. I do this a lot with families, is we just have a conversation. You don't have to schedule a counseling session for your loved one. Sometimes we're providing the support to the family, even though the person that needs the counseling, may not want to come, and that's okay too. We can discuss and strategize different approaches and interventions. So this is the 3Ds, and this is just a little image on how they overlap each other. But delirium, dementia, and depression can very much mirror each other, especially when we're talking about mood, we're talking about memory. These are things that it's really important to tease out. And I just want to highlight real quick the piece of delirium. Delirium can occur when someone has an infection that hasn't been treated. It can occur with a medication adverse side effect. It can occur from lack of sleep. For those with dementia, it can occur if there's untreated pain. There's so many things that can cause delirium. And it often, what we end up seeing with delirium is people get a little wonky. They're not at their baseline. They're acting very different. They might be hallucinating or having delusions. They may be more challenging. They may be sleeping more. Again, a lot of these things can look like depression. I wrote this really neat article where I highlighted 3 different cases where someone came in presenting with dementia, or they came in because they were depressed. And when we teased it all out, we found out it was really something else. And when we treated the other thing, the thing they came in for, improved. So very, very important to keep that in mind. And by the way, there was a huge push in the hospitals. The VA was involved in educating physicians about the 3Ds and how to assess what was going on there. So I think that was definitely needed. So all change is loss. I kind of mentioned that in the beginning, that, as we age, things change. And again, sometimes it's welcome change and sometimes it's not. Emotions in the present can trigger emotions from the past. That's something else that we can talk a lot about too, whether it's anniversaries or seasons, time of the year, smells, sense, sometimes things get triggered in the present moment that is really related to something in the past. And so that's a big piece of really the importance of understanding someone's history. And then, of course, we are all wired for connection. We're wired for love. We're wired for connection. We're social beings. We're interdependent. We're relational. There's, again, those studies that I shared about the need for connection and just honoring that and whatever that looks like for you. But, always be gentle with yourself. We're just doing our best as human beings on this planet. So here's our study, our Harvard study. Robert Waldinger was the latest one. This study actually went on for like 80 some years. It's the longest study that's been conducted on individuals. But this is just the gist of the study, that it's connection, not physical condition, that determines happiness. So it doesn't matter what a medical complication or medical issue that you are living with. You can have two people with the exact same things going on, but if one person reports they feel connected, that's going to determine not only their happiness, but their longevity, and their also, what am I trying to say? The outcome is going to be better from their condition. And then that piece about pain, that pain does not affect the mood with people who feel connected. So again, you can be, two people have significant pain, but if someone feels connected, it's going to help, it actually helps your pain. So let's move along. So interventions, this is a slide I think that is really important. And I want to spend a little bit of time here. I know we're getting down to our time pretty quick here, but I want to make sure that you know it's okay to talk about someone's mood. I think people are afraid that they may plant the seed, you know, if they bring it up, that the older adult is gonna then suddenly become depressed if they weren't, and or that you're going to make it worse if you talk about it. And that is not true. Older adults are not fragile. Let me say that again. Older adults are not fragile. They didn't get where they are, you know, through the years of life experience that they've had, being delicate and fragile. It's okay to talk about it, and it's also welcomed. So please remember that you're not going to make things worse by asking how someone is doing, or asking how their mood is. You can always offer to help find them help. So you can ask if they want to talk to somebody or go to a professional. You can help, you can schedule the appointment for them. You can go with them. This destigmatizing depression and destigmatizing help is, you know, we talked about the generational pieces there, and some people think they're crazy, or you know, they're weak, or something's wrong with them because they're feeling something. And so just reassuring them that that's, you know, that they are perfectly normal for experiencing what they are going through. Find a good geriatric primary care physician. That's always recommended. And there's a whole list of labs that we could run. Remember, we went over that biology piece. We want to rule out other things. We want to rule out nutrition deficiencies, like vitamins and minerals and hydration. We want to rule out medication side effects, thyroid levels and B12 levels and vitamin D levels. If somebody is chronically low in those areas, they likely will be presenting with depression. And so it's really important to rule those things out with a physician before then you may take the next step. Of course, finding a mental health professional that specializes in aging. I know I'm biased there, but a lot of mental health professionals are trained to work with certain populations. So finding one that specializes in working with the aging population is really important. For the reasons that I talk about in this whole slide, there's unique things that can impact an older individual's experience with regarding their mental health. And then just keep in mind, you know, depression is treatable. I want to throw one more thing out, that this comprehensive treatment thing. And what I mean by that is, you know, there are medications, there's pharmacological interventions, there's supplements, there's nutrition, there's all different things that people can look towards, you know, mindfulness therapy, things like that, that can help with people's moods. But there is a new thing that Medicare is paying for that I'm a huge fan of. They are genetic tests that you can take. They'll do like a mouth swab, or you spit in the thing and send it in, but they'll send a report back to you telling you what medications your unique body can metabolize or not. And on this report, it includes all the antidepressants, anti-anxiety meds, antipsychotic meds, pain medicines, has some other categories in there too. But you and I both know, you know, treating the mind, it's the one thing we can't just take a picture, you know, do an image of and say, oh, it's broken here, take this medicine and it will fix it. Those medications we're often spending months and sometimes years trying to find the right combination. And so this genetic test takes some of that guessing game out of it. For instance, what I, in the experience for me, I took the test, I found out that I do not metabolize SSRIs, which is the main class of antidepressant medications. So I could be one of those individuals that's trying all these different SSRIs for years and not really getting anywhere with it, or sometimes in some cases having an adverse side effect. So there's probably many of these companies. The two I'm aware of, one is called GeneSight and one is called Genomind. But the good news is that Medicare is now paying for that as well. So you can ask your doctor about that. Again, it can take the guessing game out of it. And as far as pain medications go as well. So I want to be mindful of our time. We're not, you know, I do have another slide. I'll end on this one. I'll just leave it up here. But I want to check in with Angie and see if I should keep talking or take questions, or
Go ahead. You can go ahead, Laura. We'll finish a little bit late, but that's fine.
Okay, long as you're okay with that. So the basics, you know, I wanted to talk about this because this is our natural pharmacy. You know, we talk about the pharmacological interventions that people can have, but these are the things that we can do for ourselves. Now, absolutely, sometimes there is a time and a place. You know, we have to weigh the risks and the benefit when we talk about medication. And so, you know, nobody should ever feel bad about themselves if they need to take a medication. And it's also really helpful to know that there are so many studies out there right now that show that these basics, if you do these things, it can have a better outcome than the medication. So many studies that are, and lots of cutting edge stuff. I know the University of California in San Diego is doing a lot of studies on meditation right now, and the power, again, of our minds and our thoughts, and the ability to change our biology and certainly our mood. And so, and again, I don't have the numbers memorized, but these are researchers and scientists. I've listened to them lecture a few times at events that I was at, and they're basically the same researchers that are testing pharmacological interventions. And they're saying that these certain meditations that people can do are way outranking any pill that someone could take. And so that's why I like to call these things, you know, our natural pharmacy. But getting good sleep, obviously, is paramount. You know, when we sleep, the lymphatic system, when we sleep, that part of our brain is cleaning out. It basically does a cleanse at the end of the day. And think about it for a minute. What other thing do we as human beings do 8 hours a day? Like, we don't have a choice. Part of being human is getting sleep. And so I believe that we haven't even touched on what happens to our bodies and our minds and our physiology during sleep. I know Dr. Andrew Huberman, if you listen to podcasts, Huberman's Lab, he's a huge, he talks a lot about sleep and the science of sleep, and it's super fascinating. The nutrition and hydration, I mean, that goes without saying. We want to be mindful of what we're putting in our bodies. We want to monitor our thoughts. It's always a good question to ask yourself, how do you want to feel? And because you are the master of your mind. We think that emotions and our feelings, that we identify so much with our emotions and our feelings that we think that's us. And that is not true. You are not your emotions. You are not your feelings. that is an experience that your body is having and your mind is making up a meaning around that. And so I love that sort of illustration of saying that you are the sky, you are not the weather. So you are the sky. The weather can come and go. It can be stormy, it can be sunny, it can be gloomy. That weather is going to come and go. You are not the weather, you are the sky. So paying attention to what we're thinking about our situation is helpful. Connection, we talk so much about that. Routine allows our nervous system to go into a parasympathetic state and relax and rest and rejuvenate. Movement is super important. It allows blood flow, oxygen levels. I mean, you know, there's been so many studies around that compared to an antidepressant, and movement always wins out. It just does so many things to our bodies. Stimulation, you know, wake up your mind, get curious about life, learn something new, teach somebody something. That's how we learn best, is when we teach it. Make sure you are having downtime for yourself. So listen to your body, take time to relax and repair. Again, be gentle with your nervous system. And there was one more slide. Sorry about that. This is just a little bit about cultivating resilience. And I'm not going to describe each one. I'll let you just read it yourself. If you have a question about it, you can ask. But yeah, I think we're going to end it here. And I'm happy to stay on for any questions you may have. Yeah, that was the last slide. So here's just Angie, thank you so much for mentioning my podcast. It's been a labor of love for me. We have 52 different countries that are listening to this podcast, so that's been really fun. But it's there for you as a family caregiver to gain information and support. And then there is a Facebook group if you're interested in joining. And then my business here at the bottom.
Wonderful.
Yeah, thanks for having me.
Thank you so much, Laura. You've provided, so much information today. And we do have one question, I guess 2 questions. The first one is, how do you go about finding a good geriatric PCP or mental health professional?
Very good question. I know, and this has been kind of a thing for everybody all over the country. It's hard to find those physicians that specialize in geriatrics. What I would say is, every community is different, but often often primary care physicians can be specialists, and I'm using quotes. They may not advertise themselves as a specialist, but they have a lot of experience. Some of our favorite doctors that we work with in our community are not geriatricians, but they know so much. So I don't want you to rule out or think that you can't, see a general practitioner. And I can't tell you if I'm sure there's a national website that you could look up for those doctors. I do know, and I apologize, I don't have it off the top of my head, but for finding mental health professionals that specialize in geriatrics, there's a new organization that lists those individuals around the country. And so you can reach out to them. Some of us, and I'm using myself as an example, we're not able to practice outside of our state because of our license for counseling, but some of us do coaching, and we're able to coach caregivers and older individuals by meeting with them on Zoom or on the phone from a distance, and we can coach them. Sometimes we're helping them find mental health professionals, or sometimes they don't necessarily need a mental health professional, but they're looking for some guidance and some problem-solving skills and support in that way. So I hope that answered the question. And if I remember the name of that organization that you can search for mental health professionals that specialize in aging, I will get it in here before we get off.
And we will also be sending out a recording as well as your slides to those who have attended or registered for the webinar today as well, Laura. So if you get it to me even before the first of
Okay,
next
good. I was going to try to look it up real quick, but I'll get it to you, Angie. Thank you.
Yeah, we can include that. Also, we have someone, let's see, Sherry asked, I am about to admit my mother to a Prestige community. How do I tell her that it's time to leave her home and, and to help her understand that and being in a strange place? What is the best process to work on through that?
Such a good question. And as you can imagine, every situation is so unique and different. My first thought that I would say is I would be really curious to know what her ability to understand is. We want to meet people always where they're at, whether they have memory impairment or they don't, if they're met with a lot of fear and anxiety in general. So I'll throw a couple ideas out and you can pick and choose, but again, every person is unique and different. The thing that I often will say is we really don't want to put the family in a quote bad position or an awkward position where later they're the one that's going to get blamed. So if at all possible, think about, does she respect her doctor? Does she listen to medical professionals? Having the doctor share that news could be really, really beneficial. And then you can be there to support her. You can be an ally for her in moving through that. The other thing I think about is who in the family or friend circle does she respect? Who would be the person that she would be more likely to take that news from? Again, helping the person, the primary care family member not be the bearer of the bad news. Then we can get creative about how we talk about it to her, the approach. Again, I'm always curious about the level of understanding that the older adult has, but I can share story after story of someone's friend moved in there, or I've done this a couple times where I've shared with a person that this place is very prestigious and they don't typically have openings, but you are a special woman and they made an exception for you and they are so happy to have you there. Appealing to someone's, what is going to make her feel good? What do you know about her that's going to lift her spirit, and use that to her benefit? Now, again, there's this fine line between memory impairment and not, and it's always, if somebody does not have memory impairment, we want to be really upfront and address and help them be part of the decision-making process. And then there's a whole range after that of people's ability to understand and cope. So that's just a few ideas, but we could certainly talk about many, many more.
And I know in our Prestige communities, we really focus a lot on life story of our assisted living and memory care residents, and really trying to have us prepared for when your loved one moves in with us, so that we can really get to know them right away. Making new friends is a big part of moving into one of our communities and having, maybe some of our residents who have the same likes in life and have experienced the same life things as too, to be able to connect them. We know that, like you said, connection is so important, and looking at them as new neighbors and really trying to find the best place for them and the people to sit with them in the dining room or whatever it may be to make those connections. And, we went through a lot with isolation as well in our communities. And so getting that socialization part is really key to helping your loved one feel at home where they're moving to. And so any information that you can provide to the community that you're moving into about your loved one is so important to us, so that we can help in that process. It's not just on your shoulders. And I too, as a family caregiver, I had our physician of my in-laws, to make those tough conversations with them about, loss of driving opportunities and moving into assisted living. And it really helped through that process. It helped. We're all feeling a little bit of guilt when we maybe make those decisions, or maybe we're up here on the ceiling and, things are really a tough time for us right now. And so we need the help too. And I think anytime that we can get those resources, and, that's what Prestige through these webinars or when you're visiting our communities, we want to be that resource for you to help you find the answers. Maybe it's a emergency decision you're going through for placement, or maybe it's down the road and we're just helping you through that process, but we have people to help with that. And so it is tough. We will say it is a tough decision for whether you are as an individual or on this webinar making that choice, or it's a family member. Let us help you through it. We've got a lot of experience under our belts, that's for sure.
Yeah.
We do have one more question. It says, what are the names of the 2 sources for testing metabolic absorption of drugs?
Yeah, the 2 that I have used with patients has been GeneSight and GenoMind. I'm sure there are others. What you want to look for is one that will include the most information. So the psychotropic medications and the pain medications are 2 super important categories. So I would look for one that does that. And again, I was so pleased to find out this year that Medicare is covering those costs. So many doctors are not aware of this. Many doctors are not aware of those tests, and most doctors don't know that Medicare will cover it. So you might provide that education to your physician.
Another great resource, Laura. Thank you.
Yeah, for sure.
Well, everyone, we want to thank you so much for being with us today. Like I said, you're always welcome to reach out to one of our prestige communities. We also do skilled nursing as well. And so if you go to prestigecare.com, there are many resources for you there. You can look at different locations in your area. Please feel free to call or visit our communities. Like I said, we're here to help, and that's our intent through all of these ways that we can meet you in your home or wherever you may be. So thanks again for joining us, and we look forward to seeing you at our next adventure in the future. Thanks, Laura.
Thank you, Angie, and everyone.
Bye-bye.
Bye-bye.